for people who might not be aware of the benefits and aesthetic appearance and functional mobility that can be gained through plastic surgery after weight loss, can you give us just a top line on those?
Oh, I think that the benefits from plastic surgery after tremendous weight loss are tremendous. I mean, I think that the all the way from the top all the way down to the bottom. I mean, I think that the psychologically, first of all, I think it's a means of sort of completing the journey, because what happens is that, as you know, when you're massively overweight, it's one problem, and primarily it's not only uh, physical, but also it's medical. Okay, you have all these medical issues. When you lose the weight, okay, the problems don't really go away, and I think a lot of times, the patient doesn't realize that, and it's a different problem. It's a problem of all this hanging skin, okay, which sometimes to many people can be almost as much of a problem as being overweight and having all this excess fatty tissue, psychologically for sure. So I think that by removing the excess skin from the different areas, it is definitely like completing the journey for these particular patients. I mean, in my experience, I think it's a very, very satisfying type of surgery, not only for the patient, but also for the physician to see the transformation in the patient, to see the reaction of their friends and family to what they've gone through, and how their overall not only appearance but psyche tends to change in certain areas, and a lot of times I even tell the patient sometimes they should go with a facial procedure first, because they lead with the face. I mean, a lot of times you can cover up your body and nobody sees really what's going on there, but your face basically you can reduce probably or bring back the aging process by probably 20 to 25 years, depending again on the individual. I mean, we're talking about a lot of variability from person to person. There's no question that these procedures are very, very beneficial to the patient. Uh,
How much weight should a patient lose before considering plastic surgery?
well, it really depends upon. It really, it depends upon where they are. I mean, if they start at 120 pounds, and they lose 40 pounds, it's basically going to be different than if somebody started at 300 pounds and lost 40 pounds. So again, it's a very variable type of a situation. Okay, my recommendation is that these patients tend to be stable in their weight before they go and have plastic surgery done. Now, what that means is that over a 6 months to a year period, okay, their weight should not fluctuate, should not go down by probably 30 pounds. I mean, if it's still going down on the downward slope, so to speak, then they should wait until their weight is stabilized. Because what's going to happen is that uh, if they, let's say, have a tummy tuck, or if they have a facelift, or arms, well, primarily a tummy tuck or a facelift, what's going to happen is after the surgery, if they lose, again, 40 pounds after that particular procedure, okay, you're going to have excess skin happening again. Okay, now, unfortunately, in patients that have lost and had a massive amount of weight and then lost it, what happens is their collagen is irreparably damaged. So after these particular procedures, let's say a tummy tuck or a facelift even, or armplasty, brachioplasty, you're going to have in other words, it's not going to be as tight, as it would be in somebody who hasn't had the tremendous weight loss, which means that, again, it's not going to be, as you probably have discovered on your own self, it's not going to be as tight, and you may have to go back and take even some more in, so to speak, to retighten it. There are unfortunately irreparable damage to the collagen, which translates into not being able to totally achieve the full tightening that you would want to achieve in a person that's lost a lot of weight. But you can really achieve a tremendous improvement in these particular patients for sure, as you've experienced.
So for me, I definitely have much better health habits after my plastic surgery. Some of it is because I'm just so very, very happy with the body that I have now that I don't want to ruin it. And another part is, to cough up $40,000. And then, I certainly don't want to ruin it for that reason either. So, in general, does the skin removal and muscle tightening from plastic surgery have a preventative effect on the patient regaining the weight loss from the bariatric surgery?
Not really, not really. I mean,
Hmm.
I think I remember one of my first cases that I did was a gentleman that lost in my residency. I think, I mean, he lost probably 300 pounds, and I worked on him with different procedures over 2 years, and then I didn't see him, and finally, I called him up and I said, well, I haven't seen you, and he says, well, I was embarrassed because I didn't want to come in because I've gained all the weight back. I said,
Wow.
oh my God, and unfortunately, I think that's less and less with these particular, the gastric bypass, but you do see that with with the lap band, as you know. So
Uh-huh.
there isn't anything that's going to prevent a person from gaining that weight back. But on the other hand, patients can have children after a lower body lift or a tummy tuck, and it can be uh, you know uh, removed again, so to speak, in all these different areas. So,
Hmm.
but in most cases, I think that as you said, there's a big motivation on the parts of the patient once they've lost the weight and once they've had the plastic surgery, that they don't go back and they don't gain weight because they're very conscious of what they're eating. Their eating habits are better. They exercise more. They're much more self-conscious of what they don't want to get back to, so to speak.
Was quite sure there were studies that show that there's a benefit on diabetes from removing that excess adipose tissue through plastic surgery.
Right.
So removing like the panty that we talked about.
Right. And there have been studies. I know. I mean, not many, but there have been studies that have shown that by removing the adipose tissue in the abdomen, that there is again a decrease in diabetes. Not
Hmm.
all the other problems, but diabetes by itself. But again, it wasn't in somebody that had a tremendous weight loss from these other procedures. It's primarily in someone who basically has not had, just has a very large abdomen, okay, and basically has not had gastric bypass, has not lost a massive amounts of weight, and also it's not going to help anything in a person that classically has what's called a beer belly, because they're actually,
Right.
the fat is around the intestines, and you can't reach that with liposuction. But someone who has a lot of fatty tissue on the outside of the abdomen, and they basically get that removed. Yes, there are studies that have shown that that does tend to help with diabetes.
Are there any other studies that show medical benefit from plastic surgery after massive weight loss?
If you do, let's say, on a tummy tuck or abdominoplasty, if you strengthen the diastasis muscles, you put them together, the back issues may go away. In other words, back pain, but that's going to probably be improved with just a massive weight loss also. As we talked about, you're going to be able to ambulate better if you do a thigh-plasty. You're going to get rid of the dermatological problems, the care of different areas, the hygienic care of different areas in that area, and also the breast area if it's overlapping in that particular area there. Uh, it also may help to a certain extent in the arm area if it's overlapping. So again, it really depends upon the individual. I mean, I've seen an improvement in all those areas, and we try to accentuate these areas when we're talking specifically with the insurance carriers.